I got to know Dr. Soho when she came one time to say she wants to assist somewhere. She asked what we needed and we were able to tell her. But to our amazement, she surprised each and every one of us by providing us what we needed immediately at that time.
Dr. Oweso was at one time one of my students. Now, if my memory serves me right, I don't know whether that was 10 or 15 years or 20 years ago now, but she was one of my students who I recognized even as at that time to be a well-focused, determined person. And I wasn't surprised when after she left school, she came back wanting to make some contributions to the growth of this hospital where she trained. She has since partnered with us to attract some socially responsible corporate organizations to do something for the hospital. Two major projects come readily to mind. The first one is the support for a renal dialysis center, in which she was able to work with Total to donate to the hospital some 3 hemodialysis machines, as well as water treatment plants and a generator to ensure that services are regular and uninterrupted. And we leveraged on all those supports to now decide that renal dialysis services will be 24/7. Before that time, our renal dialysis services ended at around 4 or 5 p.m. But since the support, we've been offering for patients who needed our services a 24-hour service. In fact, patients can come in the evening, get dialyzed overnight, and go to their jobs the following morning.
More machines came up and more patients. There was a big influx of patients because of the machines, and the bed made those patients comfortable because there was a difference and the patients were comfortable. So with the machines being around, Lutz was able to make more money.
And it has also increased the capacity of renal dialysis center to respond to more patients. So now at the renal dialysis center, with roughly 7 dialysis machines, we are in a better position to respond to a larger number of patients. The other project in which she has worked with us is the renovating pediatric wards. Our old pediatric wards was D1, D2, and D3. Again, this has brought life into those wards again and reduced the risk of infection to patients in those wards because the wards were totally renovated.
I dare say that all the wards, including the neonatal unit, ward D2 and D3, have been totally refurbished by Dr. Oweso and the partnering corporate bodies. They have given us incubators, they have refurbished the whole building, they have given us a generator which can power practically everything we need in this department.
So Dr. Soho has been very good to us, and we hope Dr. Soho will do more.
Yes, I will certainly do more, matron. Hello, my name is Owe, and I'm a Nigerian working tirelessly to improve healthcare systems in this part of the world. I'm based in Lagos, and having gone to school here so many years ago, medical school, I realized there were a lot of issues that affect our healthcare system in Nigeria. During COVID, we were all astonished at how unprepared the world was to handle challenges in the healthcare sector. There was lack of ICU beds, ventilators, insufficient medical supplies, masks, and all that. So I'm here today to ask that you join me to address one of the deficits in this part of the world in Africa. I would like to focus on the shortage of hospital beds across our healthcare facilities in Nigeria. We want to raise funds to supply beds to rural areas, and we want to work across the country, across various states, filling those gaps in the hospitals where they don't have enough healthcare beds. Thank you for your support and look forward to highlights on this initiative.